Hello everyone. I'm Shabana Tariq and I'm a speech and language therapist for the last 20 years and I have worked with so many children and adults. So today I'm going to discuss about childhood apraxia of speech and 5 signs of childhood apraxia of speech. So if you feel that your child is understanding everything, your child understands everything, but they are not speaking, they are pointing, they are using gestures, and they are communicating in different ways, but they are not using words. Words are difficult for them. So today I'm going to share 5 signs of speech, childhood apraxia of speech, so that you can make out if your child has apraxia. So the first one is very common that if a child has apraxia, that words come and go. It means your child says a word today and tomorrow he may not say the same word, or it will not be as clear as it was yesterday, and it is something different today. And some days are quiet, some days they are speaking words, sometimes they suddenly speak, and sometimes not at all. So this is a common sign of childhood apraxia of speech. After that, they are understanding everything, and you feel that my child understands of everything. They are much more understanding than they can speak or they can say. So this is also very common. When you give them instructions, they will understand. They know is where is the things they have kept, or where are their slides where they have to go. They understand many things, but they are not speaking. After that, they are struggling to imitate, means they are struggling to copy what you say. If you want to copy them, what you are saying, imitating is difficult for them. It's not that they are not trying, they don't want, they want to imitate. They look at you, they will try to say the sound or word what you are saying, but they are not able to say. You will feel that. So if you say ball, they will try to say it in their own way. Sometimes they may touch lips, but the sound is not coming out. Sometimes they are opening their mouth and not able to touch their lips to say ball. So there are different things, but it is difficult for them to imitate words. Sometimes they are going to speech classes, they are taking speech therapy for a longer time, and the speech therapist is always telling you that your child is not imitating us. He's just looking, or sometimes they say he's a stubborn and don't want to say, although he or she may understands everything. And then the sign number 4 is that they use only a few speech sounds, and it's so frustrating for them when they try to say and the sound is not coming out. So sometimes it's so frustrating for all the children, those who are trying to speak, but they're not saying the sounds, they're not able to copy, and some sounds are there and some are not there. Sometimes vowels are there, but consonants are not there. Sometimes consonants are there and they're not able to add a vowel to it. So it happens with this is a sign of childhood apraxia of speech. After that, when you see them, then they are speaking, they're trying to speak. Speech look effortful for them. It looks that they are trying, but it is difficult. They are speaking, but they have difficulty, or whatever they are trying to say, something else is coming out. You are asking for one sound, but they are saying some other sound. This also happens when I work with the children, those who have childhood apraxia, and it's all okay because this is a motor planning disorder. Sometimes children want to say, they know what they have to say, but they are not saying. So it is a motor planning disorder. You can almost see them trying to figure out where to put their lips and tongue, but they are not able to take out the sound. Now, what parents can do if you observe that these are the symptoms, these are the signs, if you have observed in your child. So you have to focus on communication, not perfection. You can use pictures to communicate, you can just give them simple words and meaningful things. What and the other thing is, whatever they are speaking, just accept every attempt, praise them, encourage them. Okay, so don't say, please don't say it again. Or what did you say? This is wrong. You're not saying, or you are saying in front of the child that you are, this is wrong. After that, use meaningful words. You can use simple words like mama, papa, more, go, up, because these are the words that we use in daily life too many times during the day, like go while going anywhere, going to the park, going outside, going to another room, going to the washroom, you say go, go, go. You say more while eating if your child wants more, and if your child wants more food, more bubbles, more swing, more play, you can use that up. It's a very simple and two-letter words. It's also easy and useful. You want to go up, keep it up. So in this way, you can just use simple, meaningful words and find out the core words, because core words are useful in many ways. And after that, if you find that there are 2 or 3 signs you have observed in your child, you must always seek a specialist appointment, specialist assessment, because not everyone is specialized in apraxia and motor planning disorders. So find out an expert and a specialist and book a consultation, because they may be able to give you the therapy ideas and therapy strategies which works with these children, because the traditional therapy strategies may not work with all the children with CAS. CAS is Childhood Apraxia of Speech. I'm also working for last 20 years with the Childhood Apraxia of Speech, children with CAS, and I have seen very, very good results in them. And I use different approaches, and I'm trained in those approaches. So if you want to talk to me or ask anything, please drop a comment or talk to me. All right? See you. Bye bye. See you in another video.